Ambulance crisis in Knox County. Just last week, the county opened an emergency operations center after a shortage of ambulances. Good evening. Glad you're with us for WVLT News at 6. I'm Casey Wheelis.
I'm Ted Hall. Glad you're here, folks. Now, this is the only time the county has done something like that when it wasn't some sort of a weather emergency. AMR, American Medical Response, holds the contract for Knox County. AMR says they put more ambulances on the road, but the very next day they hit level 0 again, meaning there weren't any ambulances available to take calls. In a
WVLT News investigation, we uncovered dozens of complaints over the past year of ambulances taking too long to respond or not at all. In some cases, bodies laid on the side of the road for more than 6 hours. I sat down with Knox County Mayor Glenn Jacobs for a one-on-one interview about what needs to change before they approve a new contract.
No, there are some issues, and when this contract was put in place, we were not in this environment. So it was fine for what it was, but everything has changed so much, and I think now we have 12 amendments to the contract, which we never want to see that.
An outdated contract, worker shortages, and lives left in the balance.
A lot of the issue is wait times at hospitals, what they call wall time. That's how long it takes to unload patients, as well as the volume of calls had just become overwhelming.
Knox County Mayor Glenn Jacobs says they have a plan they believe will improve the ambulance shortages with a new contract, but he says the issues are systemic.
Much of the problem actually starts, and this is not the hospital's fault, it's just the world that we live in currently, is how much the hospitals are able to accommodate as they come in and offload patients.
Right now, AMR's contract with Knox County requires them to respond within 17 minutes or get fined. So far this year, AMR's racked up more than $500,000 in fines. The county has waived most of them.
That's money that's coming to the county. We don't want it. We would rather see it be used by rural Metro for things like, or AMR, for things like training, to get more ambulances on the road.
Right now, there are 4 bids being considered from 4 different ambulance companies, including AMR. I know the county brought in a consulting firm that found problems with the current contract as it is with AMR. What steps are you all taking to rectify that as you look at these new bids?
The new contract will include things like it's more performance-based and those sort of things, as well as even the contract in the executive summary. I think point number 3 says that with the hospital wall times that's going to become challenging for anybody. But probably the main thing is really, trying to have the benchmarks so that they make sense as far as performance, as far as outcomes.
Through a records request, we uncovered emails highlighting serious issues. There's reports like this one email said they had a body laying outside for over 12 hours and a pedestrian laying out for 6 to 7 hours. I mean, that's got to raise some red flags.
Oh, it does, absolutely. And that's another thing is, deceit in transport. We have ambulances that maybe could be taking people to hospital, but under the current contract, they're being used for deceit in transport. And obviously what happens then is that gets pushed to the bottom of the priority list.
I think people want to know if they are in an emergency situation and they call 911. Like, this is a life or death situation at this point. Are they going to have someone that's going to come help them? Or are they going to lose a loved one or themselves?
They will. And when we're looking at ambulance response times, you have to remember too that often what happens is a paramedic responds, and then they're there to stabilize the person. Maybe the ambulance doesn't get there for 10 minutes or so, but nevertheless, the care is being provided.
Where does this fall right now on your very long list of?
It's number 1 right now. We really, we understand this is a big problem, and we want to get it rectified. We also want to bring some certainty as far as this ambulance contract going into the future and all those sort of things.
Now, we did reach out to the American Ambulance Association. The CEO says, quote, our nation's EMS system is facing a crippling workforce shortage that threatens to undermine our emergency 911 infrastructure. She points to Congress to do more to hire, train, and retain paramedics, something that the county and AMR says they're working to do. Now, County Commission will hear the bids at a meeting in October. We will be there and let you know what happens.